So on schools, I'm sure you've seen the study that's come out from UBC along with Coastal and Children's Hospital showing very minimal spread of the virus in a school setting. What does this survey mean in terms of what the province is planning on doing come school in September? And also on the issue of kids and vaccines, the World Health Organization clearly on its website says the COVID-19 vaccines are safe for most people 18 years and older, and children should not be vaccinated for the moment. How do you square the World Health Organization guidance for what BC is doing?
Okay, so a couple of things. One, I'll just go back to the AstraZeneca to tell you that no, we have not turned down doses, and it is available for people who don't want an mRNA vaccine, and there are some people who don't or who can't, who have an allergy or some other reason why they can't take a Pfizer Moderna vaccine. So that is still available through pharmacies, and we can assist people in getting it if they need it. So yeah, that study was one that was done independently by UBC, but is not surprising to us, and it really confirms what we were seeing on the ground, that we're not seeing a lot of transmission in the school settings. And so that is reassuring. It's reassuring to all of us that the measures in place were working, and that that type of a structured environment is a safe environment. And I think we can be very proud, and all of the educators and our school staff should be very proud of being able to keep schools functioning and safe for staff, but also so much importantly for families and for children across the province. And I think that's a major accomplishment that people have done here in BC. And this study is one that looks at seroprevalence, so it looks at whether there was infection, whether people noticed it or not, and it shows that that was very low and reflected the rates of infection in the community. So that is reassuring to all of us that the things that were in place were worked. In terms of the WHO recommendations, there's been a lot of discussion at the WHO about prioritization for immunization, and their statement reflects the fact that they have very clearly said that as a global community we should be immunizing healthcare workers and people most at risk in communities around the world before we turn our attention to immunizing those who are less at risk. And you know, that is an important role that the WHO plays in providing recommendations globally. What I can tell you is we know that there has been studies done looking at safety and efficacy in children down to age 12, and there are additional studies being done in children down to 6 months of age, and Health Canada has approved these vaccines as safe and effective in those age groups, and they are an important age group for us in terms of protecting our communities, and that's the decisions we've made in Canada and in many other countries. And I think we only need look at what's happening in the UK and in some other countries where they have not prioritized immunizing, especially teenagers, where we know that transmission can happen. And that is a group of our population age group that is very highly connected. So we can get a lot of transmission very quickly in young people. And that's why immunization is so important to protect communities, because once you get transmission in young people, you can get spillover into older people, into people who are more likely to have severe illness and end up in hospital. And we see that even in highly protected communities.